Hello everyone, welcome back to my channel. Today, we'll do a rapid review of 100 key nervous system conditions and definitions. This video is designed for quick revision and memorization of high-yield terms for pharmacy school. Brain disorders: stroke, sudden loss of brain blood supply; ischemic stroke, stroke caused by blocked artery; hemorrhagic stroke, stroke caused by bleeding; transient ischemic attack, TIA, temporary stroke-like episode; brain tumor, abnormal growth in the brain. Brain disorders: glioma, tumor from glial cells; meningioma, tumor of brain coverings; encephalitis, inflammation of the brain; brain abscess, pus-filled brain infection; cerebral palsy, motor disorder from early brain damage. Spinal cord disorders: spinal cord injury, damage to spinal cord; paraplegia, paralysis of lower limbs; quadriplegia, paralysis of all limbs; myelitis, inflammation of spinal cord; spinal tumor, growth in spinal canal. Spinal cord disorders: syringomyelia, fluid-filled cavity in spinal cord; cauda equina syndrome, compression of spinal nerve roots; spinal stenosis, narrowing of spinal canal; disc herniation, slipped intervertebral disc; spina bifida, congenital spinal defect. Peripheral nervous system disorders: peripheral neuropathy, damage to peripheral nerves; diabetic neuropathy, nerve damage from diabetes; Guillain-Barré syndrome, autoimmune nerve disorder; carpal tunnel syndrome, median nerve compression; sciatica, pain along sciatic nerve. Peripheral nervous system disorders: radiculopathy, nerve root disorder; Bell's palsy, facial nerve paralysis; trigeminal neuralgia, severe facial nerve pain; ulnar nerve palsy, weakness of ulnar nerve; peroneal nerve injury, foot drop condition. Neurodegenerative disorders: Alzheimer's disease, progressive memory loss; Parkinson's disease, movement disorder with tremors; Huntington's disease, genetic movement disorder; amyotrophic lateral sclerosis, ALS, motor neuron degeneration; multiple sclerosis, MS, autoimmune nerve demyelination. Neurodegenerative disorders: spinal muscular atrophy, genetic motor neuron disease; frontotemporal dementia, personality and language loss; Lewy body dementia, dementia with hallucinations; progressive supranuclear palsy, balance and eye movement disorder; motor neuron disease, progressive muscle weakness. Seizure disorders: epilepsy, recurrent seizures; generalized seizures, seizures affecting whole brain; focal seizures, seizures in one brain area; febrile seizures, seizures due to fever; status epilepticus, prolonged seizure emergency. Infections of nervous system: meningitis, inflammation of brain coverings; viral meningitis, viral brain membrane infection; bacterial meningitis, bacterial brain membrane infection; neurosyphilis, syphilis affecting nervous system; rabies, viral brain infection. Developmental and congenital disorders: autism spectrum disorder, neurodevelopmental condition; attention deficit hyperactivity disorder, ADHD, attention and impulse disorder; learning disability, difficulty in academic skills; intellectual disability, reduced cognitive functioning; microcephaly, abnormally small brain. Developmental and congenital disorders: hydrocephalus, excess brain fluid; anencephaly, absence of major brain parts; neural tube defect, congenital nervous system defect; Tourette syndrome, motor and vocal tics; Rett syndrome, genetic neurological disorder in girls. Autonomic nervous system disorders: autonomic neuropathy, damage to autonomic nerves; postural hypotension, blood pressure drop on standing; dysautonomia, autonomic system dysfunction; hyperhidrosis, excessive sweating; neurogenic bladder, bladder nerve dysfunction. Headache and pain disorders: migraine, severe recurring headache; tension headache, stress-related headache; cluster headache, severe one-sided headache; neuralgia, nerve pain; chronic pain syndrome, long-term nerve pain. Movement disorders: tremor, involuntary shaking; dystonia, sustained muscle contractions; chorea, irregular involuntary movements; ataxia, loss of coordination; myoclonus, sudden muscle jerks. Neuromuscular junction, NMJ, disorders: myasthenia gravis, muscle weakness from nerve signal failure; Lambert-Eaton syndrome, autoimmune nerve muscle disorder; botulism, toxin-induced paralysis. trauma and injury, concussion, mild brain injury, traumatic brain injury, TBI, brain damage from trauma, diffuse axonal injury, widespread brain injury, nerve compression injury, pressure-related nerve damage, whiplash injury, neck nerve injury. Psychiatric and functional disorders, anxiety disorder, excessive fear and worry, depression, mood disorder affecting brain chemistry, schizophrenia, disorder of thought and perception, bipolar disorder, mood swings disorder, somatic symptom disorder, physical symptoms without cause. Other conditions, sleep disorder, abnormal sleep regulation, insomnia, difficulty sleeping, narcolepsy, sudden sleep attacks, restless leg syndrome, urge to move legs, syncope, temporary loss of consciousness, brain death, irreversible loss of brain function. Other conditions, neurotoxicity, nerve damage from toxins, metabolic encephalopathy, brain dysfunction from metabolic issues, seizure disorder, secondary, seizures due to other disease, central nervous system disorder, brain, spinal cord disease, peripheral nervous system disorder, nerve disease outside CNS, neurological deficit, loss of normal nerve function.